Hello again. Now we're going to begin the topic of cancer. There are several short videos throughout this topic. Will point them out to you and ask you to please watch them. They'll help explain what we're talking about. They're mostly a minute to a minute and a half, so you should do all right with them. One of the first things I need to ask students about in this topic is if they know what certain screening tests are. My demographic knows all about these, but I have made the mistake in the past of assuming that you did. So as long as we go through this, I know that at least we're on a level playing field when it comes to discussing these screening tests. The first one is a mammography. Do you know what mammography is or what a mammogram is? Some of you might remember this when we talked about Angelina Jolie and her experience with having the BRCA mutation. A mammogram or mammography is a test where each breast is compressed horizontally and then obliquely or sideways in between this camera unit and a film plate, and it's not comfortable, but an x-ray is taken in each position. Radiologists then look at the results to look for abnormalities. This is a screening test for breast cancer. A PSA test is a screening test for prostate cancer. In case you've never paid attention to this, honestly, I'm not sure why you would, unless unfortunately you had a family member who's had prostate cancer. It's a gland in men that can become malignant. A digital exam of the prostate is done in the doctor's office. He's also eloquently pointing out, if you will, where the prostate gland is, but he's also examining it for changes to see if it's smooth, to see if there may be any abnormalities. That's one test for prostate cancer. But the PSA test, it's not a public service announcement. It stands for prostate-specific antigen. In the absence of prostate cancer, the cells in the prostate are healthy, they're organized in a tight pattern, and only a small amount of this antigen, this prostate-specific antigen, will leak out of the prostate gland itself and get into the bloodstream. However, with prostate cancer, cells become disorganized. We'll talk about that. The layers between the prostate and the blood vessels become disrupted, and more of this prostate-specific antigen can leak out into the blood as a result. A PSA test measures the amount of these antigens that are found in the bloodstream. Now that we have that kind of settled, let's talk about what's referred to as lead time bias. I'm going to talk about Beth and Nancy and their ill-fated trip to Washington, then explain how that also refers to cancer diagnosis, and opens up a whole lot of questions about screening tests. In this example, Beth is getting on a train in Boston. Nancy boards the train in New York. When they both get to Washington, the train crashes and both die. It may look like Beth was a longer-term survivor, but only because she got on earlier than Nancy. Now, how does that translate into cancer screening and cancer diagnosis? On the top, without screening, cancer starts. It could be any type of cancer, but one that takes many decades to develop. On the top example, the cancer diagnosed in this person was found because they began exhibiting symptoms at the age of 67. They were dead by the age of 70. The 5-year survival rate for this person was 0. They did not make it to 5 years once they were diagnosed. On the bottom, with screening, the person was diagnosed at age 60. This person also died at the age of 70. This makes the statistics for the 5-year survival rate at 100%, but they still died at the age of 70. The person on the bottom had 7 less years of being cancer-free because they had been diagnosed with a screening test. This leads to many questions about how effective screening tests can be. Do they prolong life? Or do they just prolong the amount of time that a person knows they are living with cancer? Because cancer is not one disease. Cancer is many different diseases, which we'll talk about. So screening tests for certain types of cancer is very controversial.